The number of people visiting the Chuka Level 5 hospital seeking better medical care and services has increased exponentially over the last 4 years, with an estimated visitation of about 13,000 patients monthly.
The services are good. You are able to understand the flow. You know that time, if you are a new person in the place, you'd really need someone to guide you through the process. But now it's clear. If I need emergency care, I can see clearly this is an emergency department.
The next 4 years is to focus more on service delivery in terms of our patients experiencing the services rather than the infrastructure, because we had put too much emphasis on brick and mortar. Now it's time we had these facilities being utilized to realize value for money.
The hospital has become a beehive of activity due to improved infrastructure and an empowered workforce that is open-minded and patient-driven. This magnificent state-of-the-art building, standing tall in Chuka town, houses specialist doctors and medics who are keen on attending to patients that come from far and wide. The management of the facility gives hope to thousands of patients who are not only residents of Tharaka Nithi County but also from neighboring counties. Technology has also been adopted by the county government as it seeks to reach more patients across the county.
Now they are at 50%.
Recently, the Cabinet Secretary for Health, Ms. Susan Nahumicha, visited the county government's health facilities, launching telemedicine at the Marimanti Level 4 hospital, paving the way for a new and improved healthcare system that allows doctors to attend to patients by way of consulting electronically.
I also want to congratulate you together with your team with the partnership that we have seen with the Google services. We've seen on first hand how a patient from a very remote facility is able to be taken care of by a clinician sitting here. And in the same breath, we have also seen how a clinician here is able to manage a patient with support from a medical officer from Chuka, which I believe is the way to go. And His Excellency, the President, in his manifesto, the plan, we are leveraging on ICT.
The county government has been at the forefront of harnessing the potential of its medics and getting the best. Coupled with infrastructure that includes state-of-the-art medical equipment, the hospital has truly put the county on the map on matters health.
We are seeking to have facility improvement fund ring-fenced in Tharaka Nithi County, kwamba ile pesa yote itakuwa kwa hospitali iingie kwa kiti ya hospitali na hizo pesa zitarudi hospitali. Kama kuna kuongeza, pesa ya hospitali itaongeza kwa barabara, lakini pesa ya barabara inaweza ongeza ya hospitali. That way we'll be able to make sure that we have more money to employ more doctors and also other cadres. And it's something we are asking all the other counties to be able to do. Make facility improvement fund function.
In supporting the bottom-up economic transformation agenda, there has been a renewed vigor by the health department as it seeks to equip all hospitals and dispensaries with the necessary medical equipment in an effort to decongest the level 4 and 5 hospitals and leave them for referrals.
Naitwa Penina Kawira CCB, nimetoka kijiji cha Kadieni. Nafanya kazi ya kusunguka na mamboma tukiwapunza mambo na afya ya mwili.
To this end, there is specific attention to preventive healthcare. The county government of Tharaka Nithi is among the first in the country to put in place community health promoters who have been assigned families they visit daily.
Tangu tuanze hii kazi, hata magonjwa yamepunguka. Kolera ilikuwa inakuja, inaua watu, inaua watoto, lakini wakati huu hakuna kama ugonjwa kolera hapa kwetu Kamanyaki, imepungua kabisa. Malaria ilikuwa inaua watoto sababu hawakuwa wanajua hata umuhimu wa neti. Wakipewa neti hawakuwa wanalala chini ya neti, lakini saa hii kila mtu analala chini ya neti.
At the moment, they number 1,265, each equipped with the necessary tools to check on the health of our people.
Kitambo tuanze ilikuwa muhimu. Ulikuwa unaenda unaambia kama ni mzee peleka mama hospitali anakataa.
Before the Tharaka Nithi county comes, mafundisho kama haya hakuwa yameonekana huku. Watu tu walikuwa wametoka mbali, alafu wanakuja just passing. Lakini hii serikali ya county ilipokuja iliajiri watu kulingana na area sao.
This is the trend across the county and is in line with President Dr. William Ruto's approach of a preventive rather than a curative model. This has also contributed to a reduction in the number of visits to hospitals and has earned the county numerous health awards. The county government has also put in place calculated measures to ensure food security in the county, considering some parts are dry. Just before the long rains, during the planting season, he embarked on a vigorous campaign urging farmers to take time and plant, while giving seeds to over 100,000 farmers in a plan that has paid off.
Kama rieto mbetawa Royce Karea wa Kirea na ndi murimi ndajire mundani ujo agatwajire mwanka wa 1970 ria twajire twandaga turengo ndengwira yetwa ya Kitharaka ende etare kinya muthumba lakini tukureterwa na imwe ikiauraga twanda ikaura lakini tukureterwa ino ikwirwa imbeo indongi certified inde irio tuonire ino ciena mafuno ngorokia inu twandaga kinya mbere.
Today, the county's farmers, especially those from green gram growing areas, have benefited as they have harvested and have enough to eat and sell.
Muthomi Njoke, pongezi sana kwa kutuletea hii mbegu tunapandanga na vizuri sana na inamea na inazaa mazao mazuri sana.
Ukienda prison zetu inakula marawa kutoka Tanzania. Ukienda NYS inakula mali ingine kutoka Ethiopia. Ukienda kwa Kenya Police College kule Kiganjo wanakula vitu ingine ambayo inatoka pale ingine. Na ndengo yetu tunatembea hapa kutafuta pale ya kupeleka. Hiyo ni ungwana kweli? Ndio sasa tumekaa chini and our beloved president akatuambia we no longer be slaves ya watu ambao wamesingira sisi kama Kenya. Tukasema tunataka chakula yetu yote ile tunalima. Hiyo ndio inafuatiwa first priority kwa soko yetu. Kwa hivyo tumesema jeshi, NYS, Police Training College, Prison Training College, chakula ya relief ile unaona watu wanapelekewa ya msaada. Hiyo chakula yote kwa sababu Wakenya wote walimi, tuhakikishe kwamba hiyo chakula inatoka hapa.
As a way to boost productivity in milk production and to have animals that are disease resistant, the county government has stepped up its artificial insemination program, now providing services to about 130 to 250 farmers per week. This has translated to higher yields for farmers, as the Agriculture Department also subsidizes amounts of monies paid for AI services. At the moment, farmers are paying as little as 400 shillings per service, down from 2,000 shillings. Also, farmers are paying much less for sex semen, which after subsidy now retails at 4,000 shillings, down from what it was about 4 years ago, 7,000 shillings. There is a dedicated call center where farmers dial 1513 to request for some of these services, and an agricultural extension officer is sent. One of the most radical yet beneficial move by the county government in the recent days is the commissioning of road marshals who will provide the long-awaited solution to the challenge of comprehensive maintenance of our county road network after substantial infrastructural investments made by the county government. Those enlisted voluntarily on this game-changing program will be key in maintaining county roads and will be based in every sub-location. Their existence and operations are derived from the Tharaka Nithi Asset Management Act of 2021, developed through the support of various stakeholders.
Kila mtu atakuwa anamiliki barabara ama sehemu ya barabara. Mimi mwenyewe nitakuwa namiliki sehemu ya barabara. Mimi ni road marshal. Nitakuwa mwenyewe mimi nikiwa road marshal, nikiwa engineer gete, na nyinyi pia kadhalika mtakuwa road marshals, wale wanatuchungia barabara zetu.
Hata ukiwa na kiwanja mzuri namna gani ya mchezo, hata ukiwa na hospitali mzuri namna gani, hata ukiwa na shule mzuri namna gani, bila barabara ni kazi ya bure. But because you cannot reach the dispensary where there is no road, that is why I say that a secretary is inspired by God.
Wewe ndio agent wa serikali katika kitu inaitwa barabara na infrastructure in Tharaka Nithi County. Hakuna siku utasikia kuna tractor inalia huko kwa barabara na huko unajua tractor inakuja kulima. Bwana Gete wa road marshals must know kuna tractor inakuja kulima. Tumesema kama kera kupitia kwa mjumbe naenda kulima barabara, let our road marshals know kuna grade inafanya nini? Inakuja.
70% of those enlisted in the Road Marshals program are youth, as the county government seeks to engage them in meaningful activities. This takes away the lurking danger that is alcohol and substance abuse.
Narudishia awangavana Mudhomi Joge shukrani mbele kabisa kwa kumaliza pombe. Isingekuwa ni kumaliza pombe, sasa hivi vijana hawangepatikana wa Road Marshals. Sasa hivi tuko sawa, ametupanga na kila kitu, tumeingia kazi na Mungu ambariki mahali popote alipo na endelee na huo uongozi.
Through established communication and reporting systems, our road maintenance crusaders will also be able to report where roads require different machinery for varying degrees of maintenance works. The road marshals will also provide public education for the maintenance of public infrastructure by engaging in public participation activities. The county government has pushed for continuous investment in road infrastructure to open up the interior and give farmers access to the much-needed markets for their produce. The government is also on a mission to correct what has not been done since independence. For instance, the people of Egangara have not had a bridge since independence. They have sometimes been forced to go for kilometers on end to access a market that is just across the waters. But the county government has now undertaken to build a modern bridge that will keep danger at bay, as well as open up space for school-going children to freely access education and for farmers to sell their produce.
Kumande kumbwa tutalo gwatandalasa ya kunania Egangala kumantakanio thiete Egangala ni kwithiritwo kwina challenge yenene muno nontu ukenda kuthie Egangala no lazima uthiururukire more than 5 kilometers uthikathwana kenda ucoka wija Egangala.
On matters revenue, the county government has over time increased collections with a targeted collection of 400 million shillings in the 2023-2024 financial year. When Governor Njuki took the reins of power in 2017, the county was just collecting 70 million shillings.
As we are the team that is spending the day there hands over the report.
In the 2022-2023 financial year, the collection went up to its highest yet at 286 million shillings.
Our assessment by Commission on Revenue Allocation is 759. That is our potential. 759 is our potential, but we want to start na kujipima na 400 so that we see how we can get there. And hakuna pesa itaongezeka ya mama mboga. Can I tell you what we collected the last financial year? I will start by 2017 when we came in. We found the previous administration and collected 79 million. The following year, we collected 127. Then we moved to 149. And eventually by the end of last year, we closed. There's a time we did 272 and then it went down again. But this time, we collected 286 million.
To undertake development and to enhance service delivery, the county government has gone out of its way to meet the target. Recently, the county government launched a fleet of vehicles that were dispatched to all the 6 sub-counties for enforcement purposes and to check on revenue.
Mko na nani kwa access point? Do you have any other officer around?
Consequently, the county government has installed CCTV cameras at access points to check on workings and to make sure that the numbers add up.
If you get to 400 million, I have executive authority to use 4 million to take you out somewhere. Uende mkanyange 4 million. Nani analeta shida hapo? Kuna shida? I am talking about the people in yellow. Hao watu naona kwa kamera.
In the 10 years of Governor Njuki, there have been tremendous changes that are visible and continue to speak to the needs of the residents as he speaks to his mantra of leaving no one behind.